Well, I have the pleasure of heading up Public Health Wales, and we're a country in the UK and part of Europe. And we're facing very similar challenges to many other countries at the moment. So we have, on the good news side, an ageing population, but 50% of our working age adults have a long-term condition already. And we have a healthy life expectancy difference between lower and higher groups of deprivation of about 18 years. So we've got some real inequality challenges, and a lot of that's gone on over history and how the country's evolved. So for us, we're very much focused now in quite a radically different way from how we've been before, ensuring that everything that we do going forward is not only about reducing inequalities, but also reducing some of the inequities that happen across Wales. So we've reviewed, as many organisations have in the current climate, what our focus will be for the next few years. And a particular area for us is about the partnership working, because we know as a public health agency that provides the traditional public health services, if we're really going to improve the health and well-being of our population, we have to do that with housing, with social services, with our local government, with education, and health is just a partner. It's not the delivery arm to address health improvement. So we've galvanised a focus in Wales on the first 1,000 days, which is during pregnancy through to that second birthday. And we have a bit of a social movement involving different government departments, housing, as I say, all the different partners, so that all of the assets that we have across the country, both locally and nationally, are very, very focused about making sure that our children on their second birthday are the healthiest that they can be, have reached the milestones that they need to be. And we know from an evidence base, from a public health perspective, that if we can do that, that creates the healthiest destiny. So there's a lot of activity happening in Wales for that, plus trying to tackle some of the wider determinants and help support that shift from secondary healthcare services through to primary and community care. This is my first IANPHI meeting. I've thoroughly enjoyed it, I have to say. We're more similar than we are different. I've just been struck with the discussions that I've had, both in this meeting and a different world of international quality and safety, that the changes that are happening across the world in population changes, in some of the challenges for ageing, and some of the challenges of trying to reduce the gap of inequalities in the countries. We're all trying to address. Many of the discussions I've had in the last 24 hours are how we've been doing it in the traditional public health way, perhaps, over the last 20, 30 years, is just not cutting it anymore, because we're not actually starting to chip away to really create healthier societies. So I've had conversations with friends from Sudan, from Mexico, from Brazil, from other countries in Europe who we work closely with, about how we can really enable community control, how we can measure and flex to knowing what works and scaling it up across a country, but how we really try and exploit the assets that we have. So I've had very similar conversations, as I say, very similar with Sudan and Brazil particularly. So I would say, and I just had a conversation before I joined you with someone saying that we may have different languages in our countries, we may have different levers and drivers around tackling inequalities, but our philosophies are the same. So how we can learn from each other and share what works, and see whether that can be transferred into another country, and just support each other, because actually the world is very small. And I've been saying in Wales and in the UK for the last year since I've been in post that if ever there was a time for public health to really support the global public's health with the challenges, it's now. So I think it's a great opportunity just to work and learn and share with other countries. Well, my organisation, before I joined, has been a member for about 3 or 4 years or so. And I just want us to be more involved, really. I've been really energised from public health, because we're all struggling with meeting expectations on us as national institutes to help transform health systems, and it's a protected space to come together and to just share some of the challenges, because it's tough, but it's exciting. So personally, it's just been a fantastic opportunity to speak to people who are doing similar roles in similar organisations, and actually we're all constructed quite similarly. There's a lot of similars there. So we're doing a lot internationally as Wales now, and we want to be able to demonstrate with our 3 million of a population that we can really drive improvements quickly, and we want to be sharing and learning with other countries. So I think it's immensely valuable and inspiring association to be part of.
Great.
Yeah, I get asked this a lot actually. I'm probably not the best person to ask, because I never pay attention as to how many men or women there are in a room. I just think everybody is, the individual that brings those skills and that leadership. My background is medicine and particularly quality and safety and regulation and health system reform before I came into public health. And I think it's more about organisations actively identifying the talent early on, whether they're male or female. So picking those leaders, and we know intuitively who those leaders are, and just developing them inside a country, outside a country, to come back in. And I think the earlier we do that, the more equitable it becomes about men or women. I think as people progress, I haven't experienced this, I have to say, but I've been very fortunate. But I think there's a tendency as people progress through the careers, I think that's where it becomes more challenging for women. But if they're caught early, be they men or women, who are the natural leaders of the future, and they're very clearly supported and developed into that leadership progression, I think that should help recalibrate having both men and women, because I think it's really important, because we are different and we do bring a different dynamic.